visiting our friend and confidant and our go-to with all health questions, Dr. Susan Lovelle of the Premier Wellness. Thank you for joining us again, Dr. Lovelle.
Thank you, Robert.
Um, well, uh, Everyone's hunkered down, or everyone with half a brain is hunkered down.
Exactly.
And it's week 3 or 6 or 12. I'm not sure, but we're well into it. But can you give us a little update about what's going on and maybe shed a little bit of the what's really going happening with the COVID-19 virus?
Yeah. So I think that the biggest thing is that what we're seeing is actually a good thing. We're seeing that in communities and countries that are really taking this seriously and that are following the social distancing to the T, really, really following it. They're actually seeing decreases in number of cases, decreases in number of severe cases. And so that's the number one thing that we need to be aware of right now, that we can get a hold of this if we do what we know we need to do, which is to social distance. Some people call it physical distancing because we're still being social. We're still kind of
Right.
talking with each other, but to keep that distance and keep our own immune system strong. Those are the big
That's one and two,
things.
frankly.
That's it.
So to a degree, it's working. Wanted to mention to our audience that North Carolina Senator Jay Chudurhi, apologize if I'm mispronouncing that, but on his Facebook page, he publishes the statistics every morning about what's going on with updates on economic and political changes from day to day. But per that site, North Carolina had 4,520 cases and 81 deaths. Um, does that mean anything to you? Just a blank statistic like that?
The problem with statistics is you literally can almost make them mean whatever you want them to mean. There are even some that are saying that, the statistics on deaths are not as clear as we'd like them to be, simply because, just because someone has a diagnosis of COVID-19 and they happen to die in the hospital, that we can't say automatically that they're related. Now,
Right.
I understand that completely, but if I'm going to fall on one side of the fence or the other, or err on one side, I'm going to err on the side of counting it, simply because if you're on a vent, you have that diagnosis and you happen to pass away, I'm going to count that as a
Right.
COVID-19 death.
Right.
Going to put it
Even
that
if you don't, not on a ventilator, that could be.
Right, exactly, exactly, exactly.
Uh,
So, yes, there are statistics, and we will follow them, but we're also, as I was mentioning, in the countries that we're seeing that they're being very, very strict about the social distancing, that numbers are starting to decrease, and the amount of rise is also decreasing, which is really more important.
so you do see us having a positive effect on flattening that curve. Um,
Absolutely, absolutely, and.
what about
Mhm.
the ne'er-do-wells who refuse to participate?
Mm. And I understand, there are some who feel that their personal freedom is being affected. I completely understand. But what they need to keep in mind is that, number one, even if they're not showing symptoms, there is a delay, even if you're infected, from 2 to 14 days. So
Right.
you may not be showing symptoms, but you may still have it and still be shedding it and sharing it with others. The other is that even if you are showing symptoms, you may have a mild case and you don't know, and so you're just kind of going out willy-nilly and infecting people who may be more at risk for having a more severe case. And so it's not just taking care of yourself, it's taking care of your loved ones and those in your community.
Right. And there's a lot of that out there. There's a lot of underlying health. At any age, that can be a case. So, one of the questions we got from our loyal audience earlier is that, okay, so we're supposed to stay out of the hospital unless we have an alarming COVID. So, can we start with what are the things, the symptoms? If we're exhibiting these, we may need to call a doctor as far as the virus is concerned.
Absolutely. I get asked this a lot. So, what kind of put is that there are two ways. Then, the first thing that you would look at is whether or not you have a fever. So, if you don't have a fever, that's automatically putting you into being less likely to have COVID-19. Not that you can't, but it's
Right.
a little bit less likely. Now, if you do have a fever, then the next biggest thing is shortness of breath. And by shortness of breath, I don't mean, you ran a marathon and you're like panting. I'm talking about you're sitting in your chair, or you're just walking around and you're really feeling short of breath. So if you've got that fever and you're short of breath, then you definitely need to speak with your primary care. Now, keep in mind though that, you may have chest pain because of a heart attack. So if something really severe is going on, or if you're worried, then still contact them. Just don't run into the hospital first unless it's a real emergency.
Okay, so if I am having chest pains or the like, we still need to reach out for professional.
Absolutely, absolutely.
Um,
That has not changed. The 911 call really hasn't changed. It's really just knowing whether or not you may or may not have COVID-19.
what are some of the bigger underlying conditions that COVID-19 affects?
Okay. So one of the first things that we think about is that we've been hearing about is those who are elderly, like
Mhm.
60, 65 and older. And it's not just the fact that they are older, it's also the fact that these are the people who tend to have more chronic diseases. And that's the second category of people.
Um,
Chronic disease like obesity, diabetes, heart disease, lung disease, history of cancer. These are also the people who are more likely to have a more severe case, and autoimmunity. Yeah.
what about those of us who hear random voices? Voices
Like you,
necessarily
Robert?
anything COVID related? No? Okay. Um, sorry, guys. Um, so, finally, in closing, I would like you to please talk a little bit more about immunity, because it seems to me that's the second thing we can do to really empower ourselves.
Absolutely. So one thing is, the social thing and the community thing. The immune system is ours. That's what we have control over. So it's not a matter of, rushing to the health food store and buying up a whole bunch of supplements and, taking supplements all day. It's really about, number one, a mindset of taking care of yourself. It's also eating real food. So this is not the time to binge on French fries and Twinkies. Now is the time to eat the foods that we know. We all know what are the healthiest foods for us, things that we recognize it as food. Eat those. Get enough sleep. That's huge. Getting enough sleep, 7 to 8 hours every night is really amazingly important, especially right now, because that's when we get rid of all of the toxins and when our body replenishes itself. And then, there are some, as I mentioned in our first talk together, there are some supplements that you can take, but just be aware that that would be an addition. The easy stuff is eating well, sleeping well, thinking well.
What I like about immunity is not one thing; it's
No,
a combination of things, and you can do a little bit every day to help two or three of the basics.
absolutely.
So you encourage napping?
All day long. Yes, actually, what I do encourage is if you're tired, if you feel tired, then listen to your body. Most of us are home at this point, if we're not an essential thing. And so if we are tired, take a nap. It's a good thing.
Um, I love a nap. I have identified 7 different kinds of naps. We'll go into that another time.
Oh,
My
sounds
favorite is the
interesting.
bath nap, where you're. Um, well, any closing thoughts, Dr. Lovelle, as we close up today's session?
Yeah, I think the main thing is that there's no need really to be afraid, to be fearful, to have this heavy weight on us,
Right.
because we actually have control. And that control is by taking back control of our own health. And that all of us have the capability of doing.
And will you mention a little bit about your video series along these lines?
Ah, yes. Oh, forgot all about that. Yes. So I'm doing actually a webinar series.
Yeah.
Have another one this Wednesday evening at 7 p.m. And what I'm doing is just going over the things that we can do, a little bit about COVID-19, the risks and benefits, but mainly the things that we can do, the simple things that we can do to change our life, change our health, so that we don't have to live in fear or concern.
What I like about it is that group aspect. When you got 5 or 6 other people on the line with you and they're asking questions you might not have thought of, and
Exactly. Exactly.
it's comforting to do it in a group.
Exactly. and know that you're not the only one with these thoughts and wondering, questions like that. So yeah, absolutely.
Right. And somebody else comes up with a thought you can bring home and neurose over. Um,
That
but
too.
Dr. Lovelle, you've been great. Thank you. Will you join us again next week and please provide another update for
I
us?
will be here whenever you like.
That's awesome. Raleigh, once again, want to remind you that Dr. Lovelle of Premier Wellness, all this and more is right here in your backyard. Join us again tomorrow and every day and discover the power of local. Thank you, Dr. Lovelle.
Thank